Thank you very much at magandang araw mga kaibigan. Nagbabalik po ang inyong programa, ang Aksyon Central Luzon Special Edition. Po si Sunny Lopez. No? At alam niyo ho, dito sa ating programa, health is a major issue, health is a major concern. That is why mas marami ho sa mga ginagawa natin, mga doktor at mga espesyalista sa medisina ang ating pong mga kasama. At alam niyo ho, isa ho sa mga co-host ko ay isang doktor at ngayon kasama ho natin siya. No? Siya po isang OB gynecologist. And of course, you know her as my famous co-host, si Dr. Rowena Medina. Ma'am, welcome again to the show.
Hello, Sunny.
I miss you, ah.
Yeah.
Matagal ka nang nag-absent. Busy ka.
Oo.
Maraming conventions, no? Maraming meetings, marami hong
But again,
pasyente.
it will be worth it naman.
And we're so happy that you're here with us because you bring in other specialists in the medical field, no,
Yeah,
for the
but
program.
for now, you should make tiyaga for it.
Oh, hindi,
Muna
okay.
na
Oo.
Anyway, it's women's health, so
Tama.
kaya ako muna.
And this is a major concern also, women's health, di ba?
Yes, a lot of patients and some of our viewers are already asking about this episode.
This episode, no? We're talking about family control, right?
Yes, family
birth
planning.
control.
We want the,
Combo yun, di ba?
we want the term na mas acceptable siguro
Yes.
kung family planning compared to birth control. Pero negative ka agad. So it's more family planning.
Yes, family planning. But tell us briefly yung ano ang definition natin sa family planning and birth control.
Well, it's actually the ability to prevent or delay or to really space the children
Right.
that they want or delay the pregnancy so that they can choose how they live their lives.
Oo.
That's how we really define it.
Especially in the Philippine setting, no?
Yes.
Dahil sa atin, barabarabay, di ba? I mean,
Siyempre sa
especially in the
atin,
rural areas.
wala yung control
Yes.
Puro birth lang.
Walang planning.
Walang planning.
Walang
oo.
planning.
Puro birth lang. Puro birth.
And we've seen that maraming negative affection for the children in the family, di ba?
Yeah, ang nakikita lang naman natin na it's more on the not negative kasi lang if it's not planned,
Yes.
if they have a lot already and they cannot provide. So, dun lang naman nagiging negative. But on the other hand, minsan naman, hirap din na wala naman din anak.
Yes.
So, it's really not for more on the negative side lang na So, we just want to teach them and to inform them of their options on
Yes.
what to do to space their kids.
Pero, what does it do to a mom? Sa mother na walang spacing tuloy-tuloy. Halos every
Kasi
year meron.
hazardous to their health din. Di ba yung term nyo na every time na nanganganak yung mother
Banwahan niya.
hindi, at saka yung isang paa
yes. Nasa hukay,
nasa
isa.
hukay na, parang gano'n, di ba? So, partly that's true. Parang meron din naman yun. Kasi you're exposing them to other conditions na delikado kapag madalas sila masyadong nagiging pregnant.
Mas this, in a family, where there's a husband and a wife, ito ba'y concern lang ng nanay o the mother, or it must be both the concern of the couple?
Yeah, men have a very important role in the birth control. But sadly, this is not often seen in our setting that
Yes.
especially Filipinos, men are very masculine ng dating.
Macho.
Pag napag-uusapan ng family planning, they just leave it to their wives, to the women. But that should not be the case.
Are there instances in your clinic where you ask the wife to bring the husband and nangyari ba? O
As much as possible, madalas we ask them to bring their husband kung pwedeng isama nila para mas ma-explain namin. But sadly,
ayaw talaga ng bihira, no?
isama talaga yung husband. Minsan nga buntis na. It's supposed to be something that they should share together, no? Hindi pa rin nagpupunta. So the more siguro kapag pinag-uusapan is planning of the pregnancy,
Spacing,
yung
no?
spacing ng family. So lalo na silang hindi pupunta.
Pero paano nagsimula to? Anong history nito? Bakit ngayon mainit na mainit? Siguro dahil sa RS bill, di ba?
Yeah.
Pero
Ngayon, parang everybody knows about birth control,
Yes.
about oral contraceptives. But actually before, ang unang-una is 1870s pa, meron na. 1930s, dyan na rin nagsimula yung si Margaret Sanger. Actually, nakulong pa nga siya kasi yung advocacy niya for birth
Activist
control.
ito Activist?
Oo, pero parang gusto lang naman niya na ma-separate yung sex from reproduction, parang ganon. So, kaso nga lang, hindi lang talaga naiintindihan dati. But during the 1960s, dun pa lang talaga na-define what birth control is, and it's a reproductive right, and motherhood as a choice. So, dun lang siya naging choice talaga at na-accept, finally.
Parang dapat may say talaga yung babae, no?
Yes. And both, actually both. But
Hindi lang yung...
mas malaki nga lang talagang say ng babae. But it's two-way.
Kasi nga sabi, it's the woman is the vessel, right?
It's but for the decision making, it should be the husband and wife.
Okay. So, ngayon, anong mga uso ngayon na ginagamit para sa birth control or spacing? What are the merits? What do you recommend if a woman or a husband or the couple, they go to your clinic and ask, anong maganda para sa amin?
Ang hirap lang kasi talaga right now, a lot of patients or a lot of women would just go directly to the drugstore and get an over-the-counter kasi narinig niya sa kapitbahay niya, narinig niya yung best friend niya, ganito yung iniinom. So, ang gagawin nila, gagayahin din nila. But actually, you have options.
Yes.
And you have an option for men, you have an option for women,
Yes.
and you have an option depending on your age, depending on what type of contraceptives you want. Either you want it permanent or you want it only temporary, or if you want it to be a hormonal one or just the barrier. Marami kaming pwedeng ibigay.
Yung
But they just
specialization
have
nyo,
to, yes, obstetricians
kayong dapat
and
na kinakausap
gynecologists,
niyan.
yes. Kailangan lang punmunta sila, and we have a specific kind of contraception that will fit them, their lifestyle, their needs, and other side effects that they don't want.
Right.
So they just have to go to their doctors and ask for an advice
Professional
before
advice.
starting anything. So it's just easy, just go to your doctor.
Pero hindi, tama yung sabi mo kanina, ang una mo sabi mo, lahat, what they hear, they just use it, right?
Oo, kasi parang una, there are a lot of side effects and there are a lot of things to consider before using any type of contraception.
Okay.
So it's very important that you should be educated before starting it.
Hindi naman barabarad.
Yeah, even the financial aspect
Yes.
that is a major concern for us can also be discussed. So they just have to ask and
Pero
go to
usually,
the
yung
doctor.
pinaka-common dyan, pinakamabilis, sa mga lalaki especially, is the condom, di ba?
Yeah, that's the ones that is, kung yun, they don't really need to go to their doctor to ask on how to do it, di ba? So walang masyadong advice.
Pero tinuturo mo pa rin yan, di ba?
Yeah, but it's just a barrier method that you don't really need to discuss about side effects or ano.
Yes.
So that's one of the contraception na, over the counter that they could just do it.
And there are also female condoms. No? I went to Thailand and saw them, itong mga female condoms ito.
But it's really not common here.
Saka pangit. Pangit tingnan. No?
It's really just not common here.
Tapos ano pa? Ano pa yung mga yung most commonly used?
We have the oral contraceptives.
Yes.
That's the most commonly used, and that's the one that is well studied. No, it's a hormonal type of contraception.
You're talking about the pills? Ganito
Yeah,
ba?
the oral contraceptives.
Oral.
Iba-iba kasi yung oral contraceptives.
Okay.
Merong, if you want it na hindi ka mag-weight gain, bawal kung smoker ka or non-smoker ka, if you have acne, so hindi lang siya, ang effect is for birth control. Oral contraceptives can also be used to regulate your period kung hindi ka regular ang period mo, kung heavy ang bleeding mo, or kung may migraine ka but still you want contraception, nagva-vary yung needs mo. Even if ayaw mong tumaba, so lahat yun kino-consider, and we have a specific kind of oral contraceptives.
Ano yung
for that.
nakakaputi tsaka nakakalaki ng boobs? Meron ako naririnig na ganyan palagi.
Actually, ang
May side effect na
lumalaki,
ganun, di ba?
lumalaki lang ang
Boobs.
boobs nila. Your breast will be enlarged if you're a man. Kaya
Ay,
di ba yung mga gay,
mga
they are
gay.
taking the oral contraceptives para
Okay.
lumaki yung breast. Lalaki naman talaga because they don't have the estrogen. So
Yes.
that's the hormones that will enhance their breast. But if a woman will take it, it's really not gonna
Pero
work
naman
for them.
nga,
Nakakaputi.
weight gain, nakakaputi, gano'n. Nakakalinis ng ano.
Yeah, nape-prevent lang yung acne sa kapag kasi nire-regulate mo din yung hormones.
Yung iba walang sex naman, walang husband, walang boyfriend, pero they're,
To regulate the menstrual
yes.
period kung hindi regular
Yung pills,
or
no?
kung heavy ang bleeding, they want to
Na ano
minimize
rin yan.
kasi they can develop anemia. So
yes.
hindi lang po kasi siya talaga purely for contraception.
So ano pa? Ano pa yan? Iba-iba pang klase yung pills. Tsaka, kailan ba take ang pills?
The oral contraceptives are usually used or yung common ngayon ng mas madalas na is on your first day of menstrual period.
Yung common.
Oo, doon ka magsa-start kasi just really have to make sure that hindi ka pregnant.
Oo.
So, yun yung start. Yung day 1.
Day 1.
We have 21, merong mga 21 lang tablets, 21 days mong iniinom, meron 28 tablets lang na iinumin mo,
Tama.
complete dire-diretso. Maraming bagong mga oral contraceptives. And then, if you miss one day, there's we tell you to take it
May bawi.
the day na you remembered it. Pwede hanggang 3 na makalimutan. After nun, tigil na. You
Tigil
have
na.
to stop.
Pag talagang matagal mo nang nakalimutan.
Oh, kasi as much as possible, you take it on the pare-parehong time.
Oo.
Kung gabi-gabi, kung umaga-umaga. Kasi it's hormones. So, para mas predictable.
Mas predictable.
Oo. Although may mga side effects, syempre.
Ano ang usual side effects? Can we talk about them? Is it all right for you to talk about it?
With oral contraceptives, the most common is may headache yung iba, may weight gain. So, kaya nga mas gusto mo na pumunta ka muna sa doctor mo and we will prescribe you the right kind of oral contraceptives
Iba-iba yan, di ba?
for you. Tas kung alam mo na meron kang mga yung tinatawag nila na vascular problems like deep vein thrombosis, hindi mo pwedeng inumin yung pills kasi lalo kang magkakaroon ng problema. Yung DVT na tinatawag nila. Kung talagang heavy smoker ka, if you're, hindi siya pwede.
How long must you take this? Kasi merong iba, taon na tinitake ito, no? When do they have to stop?
The pills right now that are out in the market, you can actually take for a longer period of time. Before kasi, after 5 years, sabi nila, you will already develop yung mga side effect like gallstones, yung bato sa abdo. So, isa sa mga complications of taking the oral contraceptives yan. But right now, a lot of the oral contraceptives na available can be taken for a much longer period of time.
Okay. So, yung iba naman, if you take them daw for a long period of time, there is temporary infertility after you stop taking them. Is that the correct thing to say?
More of the other types, the Depo-Provera or yung injectables.
Yes.
So yun yung mas meron siyang
Temporary
infertility. Kasi parang kung if you took it for a year, you expect that within a year pa, after the last time that you stopped using the injectable, that's the time lang na medyo babalik sa normal yung fertility.
So, sa bleeding, when you take oral contraceptives, bleeding pa rin yan monthly, right?
Yes, meron pa rin siyang monthly
Pero merong ibang, like what you said, yung
the
injectables.
injectables, that's why we give it to our patients who doesn't really want to have yung monthly periods nila. Meron kasing mga ngayon na ini-inject every 3 months. Meron ding monthly.
Okay.
And it's even safe for lactating mother. So, pwede sila kahit nagpapa-breastfeed, pwede pa rin gamitin. So, they have a lot of options. So, they just have to choose which one or they just have to discuss it with their obstetrician kung alin ang talagang mas fit for them, for their lifestyle.
Right. So, sinasabihin niyo sila yung pros and cons din ng specific
Yes, and everything is considered, even the financial, and even supposed to be the husband. Most of the time, they would tell you na sige po, uwi muna. Pag uwi ko, i-discuss ko sa husband ko. Mas maganda sana if the husband was there to discuss it, no? Para mas, syempre iba pa rin na ang doctor ang magdi-discuss.
Yung pwede mag-three-way na lang kayo sa ano? Habang dinidiscuss mo sa...
Skype or FaceTime. Oh, no.
Well, that can
mas
be introduced
maganda.
also, no? Yung mag-i-Skype o yung mag-FaceTime, gano'n.
If the husband is out of the country,
Yes.
that's acceptable. But if the husband is just here,
Andyan lang, oh.
Kasi di ba yung iba parang, pauwi na ako.
Oh.
Next month, nandyan na ako. So parang if they want to discuss, really, contraception is being discussed during this time. So yun siguro pwede. But ideally, they should just accompany their
Okay.
partners.
Itong mga sinasabi mong ito, mga long-term uses ito, di ba? Yung oral contraceptives, no? yung injectables.
These are
matagalan to naman.
reversible naman.
Oo.
Yeah.
Pero I'd like-
it's up to them how long they want it.
Meron bang yung nag-sex ka tapos yung morning after pill na tinatawag? Pwede bang discuss natin after the break?
Yes.
Okay. Babalik po kami mga kaibigan. This is very, very important. Alam niyo, hindi namin, especially for the children, no? Hindi naman ho natin tinuturo na mag-pills kayo or whatever, no? Kaya natin dinidiscuss ito para meron tayong information para alam natin ang gagawin natin. Especially for young people nowadays na masyadong mapupusok, tapos nakakabuntis ng wala sa oras, tapos napapabayaan yung babae. O kaya yung bata, pag nabuntis, napapabayaan ho, mga kaibigan. So, pag-usapan din natin yan pagkatapos ng mga paalalang bibigay sa iyo ng ating programa, ang Action Central Luzon Special Edition.